Good morning all. I am Dr. Shashivardhan Janjala. I am a consultant interventional cardiologist at TX Hospital, Banjara Hills. Today we are going to discuss regarding what's the pacemaker and what are the indications of putting a pacemaker and all. So coming to the basic anatomy of heart, I just wanted to tell you that why do we need a pacemaker and all. So this is our normal circulation. Like in our body, whatever the blood is there, it comes to, we have got 4 chambers in the heart first. So we have named the chambers as right atrium, right ventricle and left ventricle. So all the blood from the body comes to the right side of the heart. Okay, this is the right atrium, the chamber is called. From here, it goes to right ventricle. From right ventricle, it goes into the lungs where it takes the oxygen, and after that, it goes back to left atrium and left ventricle and continues to the body. This is a crude circulation. For this thing to happen, our chambers needs to contract. In order for our chambers to contract, the chambers need to have blood supply and also electrical supply also. So blood supply, if there is some problem in the blood supply, we call it as heart attack. So for that, we do coronary angiograms and CT coronary angiograms, and if there is some blockage, we do percutaneous coronary interventions or coronary artery bypass grafting. That will be dealt in different videos. Okay, but now I wanted to talk regarding the electrical impulses that passes within the heart. If you observe here the red lines and all, this is the electrical conduction pathway. Okay, so this dot is SA node and this dot is AV node. These are like switches with which we turn on and turn off our lights. Okay, so the moment you turn on this light, turn on this switch, there will be a conduction pathway which is going into the next switch. From here, it passes to both the ventricles, and both the ventricles needs to contract simultaneously. If there is some dysfunction and in this conduction system, then the contractility is affected and patient will present to you as loss of consciousness, giddiness, chakkar aa raha hai, kallu tirugutunnai. These will be the complaints of the patient, and predominantly these will be at the time of when the patient gets up from the bed. Okay, बेड से उठा है and immediately चक्कर आके गिर गया, ये वाला complaint होगा patient को. ठीक है, as soon as if you see this, means with these symptoms, so whenever there is, this symptom can happen with many neurological diseases also. So as soon as when the patient or your relative complains this symptom, you need to get an ECG done. So we will get an ECG, the doctor will advise you an ECG. In ECG, there will be CHB, this is complete heart block, or there are various degrees of block in the ECG. So we do the ECG, we evaluate the ECG, then we will tell whether the patient needs a pacemaker or not. So coming to what a pacemaker is. So imagine if your patient is like 60 or 70-year-old and the blood and the conduction system is affected. As we grow older, our conduction system affects, it slows down. Everything slows down. So the conduction system which passes through these conduction channels, they tend to slow down. So there will be conduction blockages. So there will be a blockage in the pathway of the electrical impulses. So we need to put an electrical extra battery here in the chest. We will cut open here and put a battery here, and we will place one wire into this chamber and another wire into this chamber, such that these coordinate the activity of the electrical impulses in the heart and pump the blood forward continuously. This battery has got lifespan, usually around 10 to 14 years of lifespan. After that, we need to change. So why do we need a pacemaker? We need a pacemaker when the inherent internal electrical impulses of the heart tends to slow down. Patient cannot function as he was functioning prior to that. So for that to contract all the chambers simultaneously, we need pacemaker. That's it. Thank you.